to the Senator from Arlington, Senator Favola.
Thank you, Mr. President. I rise in support of the amendments.
Senator has the floor.
Thank you, Mr. President. I know that we will all agree that perhaps the marketplace option is not perfect, but there are very few things in life that really are perfect. One thing we do know, however, is the marketplace option is a whole lot better than our current system. We know that our working poor are going to the emergency room when they're very sick because they can't afford to go to a doctor when their condition first shows itself. They wait until they're extraordinarily sick, go to the emergency room. It is very expensive, very costly to treat them at that point, and the outcomes are the worst. And we actually have, there's studies that show our economy has suffered the way this allocation of health resources, or this irrational allocation of health resources, has taken place. Our hospitals have a very high uncompensated caseload. They are begging us to please do something. Our businesses, the health care premiums that they're providing for their employees are going up because all of us are paying. When individuals don't have insurance and they go to an emergency room, we're all paying for that uncompensated care. And yet we're not getting good health outcomes. It doesn't make any sense. We have to start acting rationally. What I like about the marketplace option is it's not only creative, I think it blends the best of both worlds. It actually captures what we have been doing well in Medicaid, which has been that managed care option. And we've been great gatekeepers. And we've had a significant number of regulatory reforms in Medicaid that have both brought the costs down and have provided more preventive and primary care up front. And having an insurance plan that provides a preliminary or a federally required framework of benefits is not a bad thing. People will be able to understand what they're getting. Again, this may not be perfect, but I think it's a step in the right direction. And I want to conclude by saying we now have an incentive to do it because there's a considerable amount of federal money available. Why would we not accept $2 billion a year from the federal government to cover this population? Why would we continue to give $5 million a day in Virginia taxpayer dollars to the federal government so we can pay for other states to expand coverage? It makes no sense. Why would we walk away from the possibility of creating 30,000 jobs because of this new revenue coming in? This is the time to do it. I ask the ladies and gentlemen of the Senate to please accept these amendments. Thank you, Mr. President.